Can acid reflux cause cough? Yes, acid reflux can cause a chronic cough. When stomach acid flows back up into the esophagus, it can irritate the lining of the esophagus and cause symptoms such as heartburn, chest pain, and regurgitation of food or sour liquid. In some cases, the acid can also reach the back of the throat and irritate the throat and airways, causing a persistent cough. This type of cough, known as a GORD cough, is typically a dry cough that is not associated with mucus or phlegm. It may be worse at night or in the morning and may be triggered by certain foods or drinks, lying down, or bending over. If you have a chronic cough that is not improving with treatment for other respiratory conditions, such as asthma or allergies, it is essential to talk to your doctor to rule out GORD as a possible cause. Treating the underlying acid reflux can often help to alleviate the cough. You may need a gastroscopy or reflux testing to exclude acid reflux. Those tests are usually done in an NHS or private gastroenterology clinic.